So again, my name is Jen Flynn. I'm the Executive Director of Apple Schools, and I've been with the program for 15 years. We started in 2007, and I'm really grateful for Wanda inviting me today and giving me a chance to share a bit more about Apple and what we do and how we try to promote healthy schools and healthy kids for life. We'd been connected with Debbie Field from the National Coalition for a number of years. Actually, our research team had also been partnering with Debbie on a couple initiatives, and finally we decided to actually join the National Coalition, which immediately led us to the Alberta Food Matters group and the chapter here. And so we're new to this group, but definitely I've been working to promote healthy food environments for kids for 15 years and trying to showcase if we can provide supports in schools, we can change kids' health behaviors. So I'm going to share a little bit about what is Apple, how we're kind of connected to food systems, and then I'm really excited to learn from the group and the rest of the programs today. So bear with me. I also will do a quick land acknowledgement. If I can get my screen to shift. There we go. So yes, we are here on Treaty 6 territory in Amiskwacy, Waskahigan, also known as Edmonton, but our team operates across Alberta, Northwest Territories, Manitoba, and BC in Treaty 6 and 8 territory primarily, and we're soon to expand to Treaty 7 territory, so super excited about that. And I just want to acknowledge the lands that we benefit from the Indigenous people that have come before us as from time immemorial. And we're working really hard at Apple Schools to recognize our role as allies. We work with a number of schools with high Indigenous populations, but also a number of schools that are actually band operated and 100% First Nations children. So we are really working hard to transfer our role and our privilege and bring voice and opportunities to everyone as we can. So really quickly, what is Apple Schools? Now, again, I mentioned that I was with the project since it started, and so sometimes I can ramble on. And normally I have somebody from my team who flags me down. So I'm going to give Wanda that role today, that if I'm babbling, flag me down and I'll stop. But we were founded in 2007 as a research intervention at the University of Alberta. A very generous philanthropist named Alan Markin said, I want to make a donation to schools, and I want to prove that if we can provide supports to kids, we can actually make a difference in health behaviors. And so we started the project in 10 schools with that goal. We wanted to improve healthy eating behaviors, improve physical activity levels. And at the time, mental health was kind of a peripheral goal, but it's now really integral to what we do. In doing that and providing supports to schools, we can prove that we can change health behaviors, and I'll get to those fun stats in a minute. But that evidence and that passion that we had and that gift from Alan allowed the project to grow and expand. In 2015, we became our own separate charitable foundation, and now we're at the Apple Schools Foundation, and we support 93 schools, 88 here in Alberta, but a couple in Northwest Territories, Manitoba, and BC, as I mentioned, with the goal to improve physical activity. Mental well-being is a huge key focus as well, and healthy eating. So I joke all the time that we're not a binder system. I'm going to try to explain what we do and how we do it. So this is just a quick map of where our current schools operate. As I mentioned, there are 93 now. They're all over, mostly Northern Alberta, and that started because our project wanted to focus on areas of need and school communities and regions of Alberta specifically that had lower health habits and lower health outcomes. So that is why we're in Northern Alberta. But I'm really excited that by September, due to upcoming funding from the Calgary Flames Foundation, for the first time ever, we're going to be expanding into Southern Alberta. So we have 2 schools starting in Medicine Hat Public Schools right away, and we're working on finalizing Calgary expansion as well. So that's something really exciting for us, and I hope for those schools and communities as well. So what do we do? So everybody always asks, it's like, oh, is it like a program? You just start giving people ideas and you do these 5 steps and you're a healthy school. And sometimes I wish it would be easy like that, but also I know that there are lots of opportunities to do those types of programming, and we don't have evidence that they work. We have evidence that by providing supports to schools so that they can develop their own action plan and their own team for wellness, their own vision that changes year to year, we see health behaviors change for kids over time, and we see evidence of changes behaviors in homes, in community partnerships growing, in improved leadership skills and improved, academic scores. We have 15 years and over 30 publications on our website that you can take a look at. But we work with every school community because every school is different. And we've heard over and over when we started that the biggest barriers to change in schools were 3 things: time, funding, and training or resources. So we built a program with that model, and we knew that time in schools is expensive, but we knew that that's the biggest piece to try and create change, is actually giving people in school communities time to do this work. I think everybody who I've ever met with is passionate about kids' health and wellness and kids' health habits, but giving the time to actually dedicate to do this work is what's one of our key integral pieces. So the school communities each hire somebody that they believe is best to be a catalyst for change, and someone who can bring voices together to create that action plan and bring some passion and excitement to kind of be that boost to make a shift in culture. We then provide the schools a little bit of funding and resources, because we know sometimes that can be a barrier, and whether it's perceived or real, we know it makes a difference. And if you have a budget line item, it becomes more important, whether it's at the leadership level or the board level or right at the school level. We know that having that little bit of funding tied to health and wellness shifts the priorities around it. And then we really focus in on training and education. So we provide training for the people in the community that are doing the role for Apple Schools, but also provide professional learning opportunities for teachers, for parents, for student leadership groups, for community members, and try to make sure that we know by understanding comprehensive school health, understanding health promotion, understanding healthy foods. That's one of the kind of foundations to making change as well. We have a philosophy that's once an Apple School, always an Apple School. And so even our schools from 2007, we ask them year over year, do you want to be a part of this program? Are you interested in continuing partnering with us? And they say yes. So when I say 93 schools, that's 93 schools that are actively participating with us, actively creating an action plan each year, meeting with us throughout the year to say what's working, what's not, measuring and opportunities are available to say, is what you're doing making a difference to health, eating, physical activity, and mental well-being, and then recycling that year over year or changing it year over year. I mentioned that we are a research project, so we have a 1,000,001 stats, and I mentioned over 30 research publications, peer-reviewed scientific papers. We're recognized as a best practice on the National Cancer Institute's website as a tested intervention for children. We also were recognized by the Public Health Agency of Canada and through another organization called 100, which picks the top 100 education programs that are innovative in the world. And I'm confident that the thing that sets it apart is not just the wonderful work that's happening, there's the fact that it's backed by our team's research. So in providing these supports to schools, we know that we can improve kids' physical activity levels by 35%. We can improve the number of vegetables and fruit they're eating and their diet quality by 10%. We can reduce the chances of overweight and obesity, although that is not our focus. It's an outcome that we landed on. And we know that these changes affect leadership, as I mentioned, academic performance, reduced number of mental health visits to doctors, improved feelings of future outlook for kids. And recently we had a peer-reviewed study that take a look at return on investment. So we know, I think like common sense, we know that if we invest in prevention, we're saving a lot in the future. But this is actually a scientifically published number of every dollar spent in Apple Schools will save the provincial government $8.60 in avoided healthcare costs and other social related issues. So there's much more on this. I feel like we've presented this data all over the world, but it's exciting for us to continue to showcase it. So what's our connection to food programs and kind of why are we here and why are we part of these tables? We know that food is an issue in every single school. And I think schools become the landing place for food programs because kids spend the bulk of their time in school. We know that kids who are hungry can't learn. And we also know that people are really excited and want to find ways to provide access to food to kids as there's such a need for it. We work with 93 schools and every single one of those in their action plans has providing access to healthy foods to kids. And whether that's through a breakfast program, a snack program, a lunch program, or all three, it's a really important piece of the work that we do. We don't provide foods. That's one of the biggest misconceptions for Apple Schools. Two misconceptions. One, they think that we provide foods. Two, they think we provide iPads. So we're neither of those things. We're a support system. But we work to say, again, how can we help integrate healthy foods into what you want to do for comprehensive school health? And how can we build it into a plan so it doesn't just become a one-off each year or the person who ran it left and it was, it's just the next person is starting from scratch. So we try really hard. And again, in every one of our schools has a person dedicated to this work. And that person's role is figuring out what has the school done in the past, what options are available, how can we support them to make sure that food's available, and then how can we make sure that that food that's being provided is connected to education programs, that it's connected to a positive social environment, that it's connected to the partnerships that are on the table so that the Boys and Girls Club that comes in and runs after school programming, understands the food policy in the schools, but also understands the needs and how food fits into a positive environment and a healthy school community. Everything that we do, as I mentioned, is rooted in comprehensive school health. And when I learned about the National Coalition's values, which I think just are, so integral to the work that we're doing, that's really where the alignment met with Apple Schools, and that we're really trying to have a non-stigmatized, autonomous plan for providing kids healthy opportunities. And again, food is one of the biggest things. Okay. So I tried to bring this to life in a little bit of stories, because still when I talk, people are like, I don't really get it. And so I mentioned every school is different, and I wanted to share a story from one of our schools in Edmonton. St. Kateri School has been with us since 2007, and they've always had a way to provide food to kids. And they've had a snack shack, and they've had a grab and go cart. But this year they developed something called the Healthy Eating Squad. And it was actually a grade 6 student who said, we need to make this fun. We want to be a part of the food providing at our school, and we want to make it exciting. So they created a grade 6 team of kids, which isn't uncommon in schools. But this group of grade 6 kids comes up with a plan. They figure out what they want to taste test with the kids, and they build menus for the Healthy Eating Squad so that kids can have food, a snack every day delivered across to every single kid should they want it. So the grade 6s build the menu. They also work on building out the costs of options, which if you're a teacher or working in schools, one of the biggest new pieces to the wellness curriculum is financial literacy and having it fit in with wellness. So they really did a great job of building that piece in. But they also then have figured out a way to strategically deliver it to all of their kids in all of their schools. And I think so often, one of our essential conditions for Apple Schools and for comprehensive school health is student leadership, but really engaging kids to get excited about schools. And I think we know that that's the path. These kids now have the opportunity to participate in building those food options, make the menus, deliver the food, and I think showcase to the teachers and to their parents that they can be leaders in providing healthy foods to kids in schools. We work really hard. Apple Schools doesn't have guidelines or policies. We work really hard to support Alberta Health's guideline for Alberta Health's nutrition guidelines, for children and youth, but also district level policies. Every district has a policy that has to do with healthy eating and food provided in schools. And then we work hard with schools to say, what does your food policy look? How does it build on those pieces? And how can we try and make sure that this food is served in a good way, in a positive environment, and also has some nutritious aspects to it. Food is served in a number of ways, and it's not just food programs in schools. We work hard to help schools. What we say is put on your health glasses. So take a look at what you're already doing, and is there a way that you can put on your health glasses? And so much of that lands around schools. There's gardens and lots of classrooms that we connect to curriculum, but then we try to build that garden and add lettuce to sandwiches as part of the lunch program, for example. We work to do taste tests in schools because we have research that shows if kids are exposed to more foods, the more foods they will like, the more foods they like, the more foods they report eating. And it sounds like a no-brainer, but if we can provide opportunities for kids to try foods in school and make that a positive experience, that translates to lifelong healthy habits. We do candy exchanges at Halloween, which has actually started from one of our schools in Northern Alberta as a partnership with a dentist. And they said, hey, if we gave you some funds for some non-food rewards or some healthy foods, do you want to try this out? And the school taught us that if you give kids a chance to change in their candy for stickers or pomegranates or snap peas, they'll do it. And it's fun to do, but it also creates a neat environment where you can, celebrate healthy eating and showcase to your partners that, kids want to participate in healthy options. There's so many more examples, and I could, as I mentioned, every single school is different. And so every single school does things in a different way. But my favorite is this quote from a child who was talking about gardening. And he said, my favorite day was when the harvest was ready and the whole hallway smelled like tomatoes. The rainbow chard was delicious. And I think we forget about that experience. I know at Alberta Food Matters, we talk about that relationship and the participation with food, but kids get so excited about it and get to participate together in something in a positive way. And we know, again, all of these activities translates to to changing health behaviors. They're nice stories. They're the right thing to do, but they also make a difference for kids' wellness for life. That's kind of like the nuts and bolts of what is Apple and what we do. We are governed by a board of directors as well, so I always make sure to give them a bit of an acknowledgement and shout out. As I mentioned, every school is different, and so we share a lot of our stories on social media. So take a look and follow us on Twitter, Facebook, or Instagram. Our schools are constantly sharing what they do, so you can bring it to life for schools. We also have a website there. It's appleschools.ca, where there are free resources that schools and community partners. We just had actually the senior center in Lac La Biche, which we partner with 2 schools there. The senior center started doing our taste tests. So we have little forums that say like, I tried it. And there'll be, I think there's like 65 different fruits or vegetables built by registered dietitians to say, I tried a blackberry and I liked it, straight face or sad face, and then a little recipe on the back or a fun fact about blackberries. And so they did it with the seniors. It doesn't have to only be about school, but check out our website if you're interested in free resources that are available for everyone. And then I would be remiss if I didn't let you know who funded us. So we are completely privately funded. As I mentioned, we were founded by a philanthropist, and he pushed us to transition to be our own charitable foundation. And so now we are completely reliant on the generous support by Canadian Natural, Interpipeline, St. Michael's Hospital Foundation, Leap Cope Center for social impact, and also Staples, which is a new partner that just came on board. So I really want to thank those folks, because everything that we do, all the funding that we're able to provide schools, all of the people in place are all due to these folks. If you know anybody connected to these wonderful organizations, please say thanks from me.